Have you ever watched someone you love with dementia do something that, well, just doesn't make any sense? It can be really unsettling, can't it? But what if their reality is totally different from ours in a way we just haven't considered? Today, we're going to dive into the really profound link between dementia and eyesight, and I think it might just change how you see everything. And we're basing this whole explainer on some fantastic insights from DailyCaring.com. They are an amazing resource for caregivers, and they really help us get to the bottom of what's actually going on. So let's start here, in this confusing new reality. I think for so many caregivers, one of the absolute hardest parts of this journey is seeing these behaviors that seem to pop up out of nowhere. It just creates this confusing new world for everybody. And it leads to the question that I know weighs on so many of us. Why? Why are they acting so strangely? You see them, picking at the air, or maybe they hesitate to walk across a room, or they can't find something that's sitting right there in front of them. You just can't help but wonder what is happening inside their head. And let's just be real for a second. It's stressful. It's scary to see these changes and to feel that sense of disconnect. And of course, it makes us fear the worst about what's happening to their mind. But this is where we kind of need to shift our whole perspective, because while dementia is famous for its effect on memory, it affects the brain in so many other ways. Our first instinct might be to just label these behaviors as hallucinations. And sure, that can be a symptom. But what if the root cause is something way more fundamental? What if it's not about what they're imagining, but about what they are literally seeing? Okay, so here's the absolute crucial point. Dementia fundamentally changes the partnership between the eyes and the brain. The eyes might be working just fine, taking in all the information correctly, but the brain just can't process that visual data the way it used to. And that brings us to the real heart of our explainer today. How exactly does dementia change a person's vision and, with it, their entire perception of the world? Well, according to the incredible dementia expert Teepa Snow, there are 3 common and really significant changes to vision that can explain so much. Let's break them down one by one. Okay, first up, the field of vision starts to narrow, and I mean it narrows significantly. This isn't just, a normal part of getting older. This is a really dramatic drop in their peripheral awareness. Teepa Snow has this brilliant way of helping us get it. She says it's like they are looking at the world all the time through a pair of binoculars. Just stop and imagine that for a second, trying to navigate your own home like that. And to put a number on it, their field of view can actually shrink down to a circle that's only about 12 inches across. Anything outside that tiny little circle, it might as well not even be there. And that is why they may not see the cup of water sitting right next to their plate. All right, the second major change is the loss of depth perception. Our ability to see in 3 dimensions, to judge how far away something is, that starts to just fade away. And the reason why is pretty fascinating. See, as dementia progresses, the brain starts to get overwhelmed trying to process information from 2 separate eyes at once. So to cope, it basically just starts to ignore the input from one eye. And when that happens, there goes that crucial 3D vision. So what happens then? Their world literally flattens out. A picture and an apple and a real apple, they can look exactly the same. And a dark pattern on a rug, it isn't just a pattern anymore. To them, it can look like a terrifying, bottomless hole in the floor. They just lose the ability to tell the difference. So when you combine that binocular vision with a flat 2D world, well, the result is just profound confusion. Their environment becomes this puzzle that's pretty much impossible to solve. Now, when you put all of this together, this is where we get that aha moment. All of a sudden, those strange behaviors we talked about, they start to make perfect, logical sense. Just look at this. When you see someone picking at the air, they might be trying to touch a ceiling light that, to them, it looks like it's right there within arm's reach. When they can't find their fork at dinner, it's probably just outside that tiny 12-inch bubble of vision. And that hesitation to step on a dark rug, they're trying to avoid falling into what their brain is telling them is a dangerous pit. You see, it's not random, it's not irrational. These behaviors are completely logical reactions to the distorted, fragmented, and confusing world their brain is showing them. Honestly, if we saw the world the way they do, we would be doing the exact same things. And understanding this is a total game changer because it moves us from a place of fear and confusion to a place of action. We can't fix their brain, but we can change their environment to make it safer and easier for them to navigate. So here are a few really practical things you can do. First, improve the lighting. Get rid of shadows that can look like scary holes. Next, try to reduce busy patterns on floors or walls. Solid colors are so much better. Use high contrast visual cues. Think a bright red plate on a plain white placemat. That really helps things stand out. And maybe most important of all, just lead with this new empathy and understanding. I think this quote just says it all, doesn't it? What looks like confusion to us is really just a simple, logical reaction to a world that has become visually broken. And that leaves us with this final thought to take with you. Now that you can see the world a little more like they do, what's one small change you can make? One single adjustment to build that bridge of understanding and make their world just a little bit safer and a little less frightening, starting today.